Welcome back to Doc Saying Stuff by AHSM. One of the first medical topics that I was ever exposed to was blindness. My grandmother was blind for 65 years. Let's go to our expert, Dr. Rupa Wong.
Blindness is a legal definition, so it actually varies state to state. But in most states in this country, they define blindness as when your central vision, when you're wearing your glasses, is less than 20/200. There are a lot of different ways that we can test vision in the office, but the easiest is just with an eye chart. Most of the time, we now have computerized eye charts. We'll get you to read those letters with the big E at the top. One of the most common causes of blindness in the United States is diabetic retinopathy. It affects 5 million Americans, and it's when your diabetes is so uncontrolled that it causes changes in the retina. Specifically, the blood vessels start to leak, they hemorrhage, and they can cause even ultimately retinal detachments. So it's something that's very preventable if you have good control of your diabetes. But worldwide, cataracts is the number one cause of blindness. And that's because in many countries, in many particular cities, or even in the villages, cataract surgery is just not readily available as it is in the industrialized nations. Blindness can be reversible. It just depends upon the cause of the blindness. Something like cataracts can be removed surgically, and then the reason for the loss of vision can be improved. Amblyopia, which is a decreased vision in a child's eye due to a number of different consequences, unequal glasses prescription or misalignment of the eye. If a child wears a patch and undergoes patching treatment or amblyopia therapy, then they can go from 20/200 to 20/20. I have seen it. I have patients that this has occurred. So in that case, blindness can also be reversible. Many of the diseases that cause a decrease in vision can typically be slowed or controlled, but not necessarily reversed. But there are a handful of cases and conditions which can be.
Thanks for joining Doc Saying Stuff. Be sure to comment and leave requests for the next medical topic.
And tell us what other topics you're curious about so we can dive through them right here. We will see you next time.